You can reference back. Um, it'll be posted through the BSK blog, um, and I believe our slides will be up there as well, so you can access that information. But welcome everyone. So this is the information session for the lead and traditional eyeliner RFA that we are releasing. And my name is Ashley Bullock. I'm an educator consultant with the Lead and Toxics program here at Public Health Seattle County. And I manage our Best Starts for Kids funding for the Lead and Toxics team. And I'm joined by my colleague, Hannah, if you want to,
Yeah.
sorry.
Hi, everybody. My name is Hannah Pervin. I'm also with Public Health Seattle King County. I work in the hazardous waste management program, also as an educator consultant, and I will be managing the contracts funded through the Haz Waste funding stream for this RFA.
And we're joined today as well by Phil Thompson, who is our contract specialist, whose name you will see on the RFA. Phil, do you want to introduce yourself real quick?
Sure. I'm Phil Thompson. I'm a contract specialist for public health who supports all of the Best Start for Kids funded contracts.
Thank you, everyone. And we're also joined by Sava and Sylvia, who will be supporting this project. And if you want to introduce yourself real quick, you're welcome to.
Sure. Sabal Harazi. I'm a contract specialist in public health. Thank you.
Hi, I'm Sylvia Lim. I'm the finance officer, one of the finance officers in the division.
Thank you, everyone. And for folks who are just joining us, if you're able, and please put your name and your organization in the chat so we can see who is here. And again, just thank you for taking the time out of your day today to join us to learn about this RFA. And I'm just going to jump right in. If you have any questions, please feel free to put them in the chat. We'll be monitoring that, and we'll try and pause as they pop up so that we can make sure to answer any questions you have. There is a recording that will be shared via the BSK blog, so you'll be able to reference back to this recording and see our slides and all the information as well. And today for our agenda, we're going to go a little bit over who we are and what our program goals and purposes are and how we're partnering together on this project. Then we'll provide a bit of background on lead and traditional eyeliner and what has led to this specific RFA to be released and the great work that's been done by other community groups and our hazardous waste team. We'll also share the RFA details, some summary of kind of what is included in the RFA itself and what the program will look like. We'll go over the application criteria and the rating criteria, and then how to apply, since this is for folks who we'll be using a new application tool online called Agiloft that some folks may have seen with DCHS, but it's the first time that our team and I believe most of public health folks have used that online tool for applying. So we'll go through that a little bit and show you how to access any resources if you need help. And then we'll give a little bit of overview of what to expect if selected, what the contracting process will look like, making sure you understand kind of the typical financial management kind of pieces that we'll expect for invoicing and things, as well as we'll talk a little bit about evaluation, and Phil will speak to insurance requirements that are important to know about. And again, welcome everyone. And if you have just joined us, please put your name and your organization in the chat so we know who is here. And thank you again for joining us. So a little bit about who we are. This is kind of a unique RFA. We are partnering together. Henna and her team, Aisha and Rhoda, are partnering with me from the Lead and Toxics team to offer this funding opportunity. And so I sit under Best Starts for Kids with the Lead and Toxics program, and Henna is a part of the Hazardous Waste Management Residential Services program. But both of us sit under environmental health within public health. So that's where we are. And this is just important to know because there will be two different funding sources, and depending on your application and who you're who you're applying to serve within the community, that'll determine whether you receive funding from Henna through the Hazardous Waste Management Program or through myself through the Best Starts for Kids program. And we'll talk about that a little bit more. But the project itself will be the same. We're just offering we're combining our resources to do this project. A little bit of background on Best Starts for Kids. Best Starts for Kids is a levy-funded what would you call us? A levy-funded program that is aimed to strengthen families and communities so that babies are born healthy, children thrive, and establish a strong foundation for life, and young people grow into happy, healthy adults. And I sit within the prenatal to 5 strategy in Best Starts for Kids, so focusing on younger youth and pregnant people. And we are a part of the environmental support strategy. So here we are. There's many different Best Starts for Kids programmings and strategies, but again, we sit within prenatal to 5, and I am a part of the environmental supports lead and toxics program. And so again, our funding source is BSK. We're a part of that prenatal. We stretch it up to 6 because of lead, but we'll talk about that a little bit more, but technically prenatal to 5. And our goal and purpose for our program, the Lead and Toxics program, is to work with community-based organizations to identify current and emerging sources of lead and toxics in our communities, reduce exposure sources, and strengthen systems to protect those most at risk of lead poisoning. So we focus a lot on working with medical providers, working with community-based organizations, and trying to understand what is currently impacting families and leading to higher rates of lead poisoning in our communities. I'll pass it to you, Henna.
Thanks, Ashley. Yeah, in my program, the Residential Services Program within the Hazardous Waste Management Program is dedicated to minimizing household hazardous material exposures for King County residents. And through community projects and partnerships, centered on racial equity, we empower residents to identify and address risks in their homes and surroundings. And also a core component of my program is to support families with children who have elevated blood lead levels by conducting environmental health investigations to identify sources of exposure, including sources from consumer products.
And we'll reference back to the funding sources a number of times when we get into the questions and the rating criteria, so you can understand a little bit more about how folks will be selected for whether they receive the Best Starts for Kids funding versus the hazardous waste funding. But again, the project work will be the same. We'll all be working together on the entire project. And then we also just wanted to ground in on the Children and Youth Advisory Board's equity statement that was created as a part of Best Starts for Kids, but really underlines all of the work that we are doing here at King County Public Health. And specifically that equity is an ardent journey towards well-being as defined by the affected, that equity is disruptive and uncomfortable and not voluntary, and that equity is fundamental to the community we want to build. And we hope that you will see these principles are reflected in the application questions and thinking about how you do your work and how we're proposing for this project to work together is to center equity and anti-racism in the approach and the final products that we create together. Is this you? This is still me? Sorry, this is still me. Okay,
yeah.
I'm trying to remember. So I'm just going to give you just a little bit of background on the RFA, just a high level, and then I'm going to pass it off to Henna to give you background on how we got to this project. So our goal for the organizations that are funded through this RFA is to work together to partner on reducing exposure to lead from traditional eyeliners through the co-creation of culturally and linguistically appropriate outreach, education, and community engagement strategies. And so we'll be working together to think about how folks are using traditional eyeliner, what kind of messaging and education would be helpful to reach people with, and what that would actually look like within the communities that you serve, whether it's education through existing programming that you're doing, things like social media or other types of outreach that will get those messages across to the many families that you serve. And another big piece of this is that Henna will go into is that this has been a long ongoing project, and we know that there's a lot of research showing lead in traditional eyeliner is a concerning source of exposure for families. And we want to make sure we're taking that research and putting it into real world prevention efforts to reach families. And our goal is by the end of this project that we are helping to increase awareness of lead exposure risks, that we're supporting families in choosing safer products and understanding risks from products, that we're strengthening community knowledge more generally about environmental health, and that we're encouraging blood lead testing for children. So those are some of the, in addition to specifically, hopefully lowering the use of traditional eyeliners that contain high levels of lead, these would be some of the other outcomes we would be looking at for the programs. And from a high level, the total amount of funding that is available is $279,500. The funding request per organization is $55,000 for the project work. And then there's also some optional meeting event hosting funding that we're hoping some folks would be interested in. And the application due date is May 29th, and the contracts ideally will start September 1st and will go through the end of 2027. So it's a little bit of a funky timeline that we wanted to just call out, that it will be September 1st through December, so a little over a year. And we're anticipating awarding up to 5 organizations through this RFA. And we highly are encouraging small nonprofits and community organizations to apply for this RFA, but it is open to all nonprofit organizations, community-based organizations, tribes and tribal organizations, for-profit entities, and public or governmental agencies serving communities in King County. And here's the timeline that is in both the RFA and in the blog post, but just at a glance, some of the important dates. Today we are at our online information session. Final day to submit questions via Agiloft, which is the online portal for submitting your applications as well as submitting questions, is May 21st. The final day to initiate requests for technical assistance, which we'll speak to a little bit later, is May 7th. And proposals are due May 29th by 2 p.m. From there, we will have your responses reviewed by our review panel, and that will occur from mid-June to late July. If there is a close, if the panel is not able to make a decision on the final 5 funded organizations, we may do some short interviews with the top applicants, but potentially that may not happen if there's clear selection of funded orgs. And then we hope to let everyone know if they have received funding by July, end of July, with contract negotiations happening in August and ideally a contract start date by early to mid-September. Okay, Henna.
Thanks, Ashley. I'm going to let you watch the waiting room. I've admitted everybody so far. Okay. Yeah, so before we talk more in depth about the RFA, I want to take a step back and talk a little bit more about lead in traditional eyeliner and how this RFA really came to be. So this product goes by a lot of different names. You might have heard of Kohl, Surma, Kajal, Itmid, Tiro. Different cultures really use different terms, and they're often referring to the same type of like eyeliner. It is typically applied right along the inner eyelid or the lash line, and this practice is really common across South Asia, the Middle East, parts of North Africa, and also East Africa. And this is not a new practice. These products have been around for centuries, and not just for beauty, but also for religious, cultural, and sometimes even medicinal reasons. They're used for those reasons. And a lot of these products are homemade or are purchased from local markets or imported stores, which make them really hard to regulate or standardize. And while some of these products are made with natural ingredients, yeah, and West Africa too, we will mention that in the focus community. While some of these products are made with natural ingredients, many have been found to contain lead or can also have other heavy metals, which is where the health concern really comes in. I'm going to just let you do it, Ashley, advance my slides if that's okay. Thank you. Thanks. So why does this matter? So when we have tested these products and also other organizations have tested these products, many have found that they contain very high levels of lead. And one of the biggest challenges is that you can't really tell if it contains lead. And lead isn't something that you can see, smell, or feel, and a product might look completely safe, but still contain really harmful metals and harmful amounts of metals. And lead exposure specifically can have very serious health impacts, especially for children. It can affect their brain development. It can lead to learning and behavioral challenges. And it can also slow growth and development, and in some cases cause anemia or damage to organs. And for people who are pregnant, it can impact the pregnancy and also the health of the newborn. And one of the most important things to remember is that there is no safe level of lead. Even a small amount can cause harm. And those effects can be long lasting and in some cases also irreversible, which is why prevention is so important. Next, please. And a little bit about eyeliner testing in King County. So we at Public Health Seattle King County have conducted investigations in the homes of children with really high levels of lead, blood lead. And we have also conducted community product testing events in King County where people bring their items to be tested for lead. What we found is that some traditional eyeliners had really high, extremely high levels of lead. It is important to remember or know that the recommended federal limit for lead in cosmetics is 10 parts per million, and in Washington state, legal limit is 1 part per million. So the eyeliners that we were testing had 10,000 to 100,000 times more than those limits. So these findings really tell us that this is not a minor contamination issue, but it is like a significant source of lead exposure for communities that requires targeted outreach, education, and even harm reduction efforts in these communities. Next, please. Yeah, thank you. You can just go ahead and press next and everything will appear. Thank you. Yeah, so I want to walk you through a little bit about how this project was designed. It really started in 2023 or even earlier, but it was formalized in 2023 where we started with phase 1. We conducted a needs assessment focused on traditional eyeliner use in one specific community. And we connected directly with 32 households from that priority population to understand how these products, like, the traditional eyeliners were being used along with their level of knowledge and also concerns related to traditional eyeliner use. And then also in 2023, we started phase 2, which was a community forum centered on lead in traditional eyeliners. Basically, the same people from phase 1 participated in phase 2. And this was a space where participants could share experiences and learn from one another and also validate and deepen what we had heard during phase 1. And then a year later, in 2024, we started phase 3 to evaluate basically to go back to the individuals who had participated in phase 1 and 2 and learn the impact of the project so far. So we followed up with those participants from phase 1 and 2 and looked at not just awareness of lead risks, but also if behavior had shifted and how it had shifted. And then last year in 2025, phase 4 really began. The community outreach and expansion began. We expanded beyond the community we were first working with. So in phase 4, we worked with community navigators that represented many different priority populations that are also part of this RFA, that are identified in this RFA. So the community navigators came together to build a foundation of an outreach plan, and that plan is really now the basis of this RFA that we will continue to develop and then start implementing through the next phase of this work in 2026 and 7. Next, please. Yeah, so we'll go back to the RFA and talk a little bit more in details about funding priorities and other things. Next, please. So shifting back to this RFA's funding priorities, just at a high level, the focus of this work is reducing lead exposure, especially for children, pregnant people, and families, linked to use of traditional eyeliners. And we are prioritizing communities where these products are commonly used, including South Asian, Middle Eastern, Northwest, and East African communities. And that said, this RFA is actually, there's somebody on Teams. Okay. Um, this RFA is not just limited to those priority groups. We also welcome organizations serving other communities where traditional eyeliner is used and may pose similar risks. And like Ashley mentioned before, organizations that serve communities who regularly use traditional eyeliners on children, infants, and pregnant people will be prioritized for Best Start for Kids funding. And the other applicants will be awarded HASWAYS funding. But like Ashley said multiple times, it makes no difference to the awardees. It will be seamless. You will not know the difference. Like it's just how we are pooling our money. Next, please. And in addition to the focus communities, we are also asking applicants to think about other factors that may increase someone's risk to lead exposure. For example, communities with lower incomes or communities of color often face higher exposure risks due to systemic and environmental factors. Also, children who are eligible for Medicaid or families living in subsidized or low-income housing may be at greater risk as well. And okay, thinking about unhoused people or those experiencing housing instability. Also, immigrant and refugee communities include those that are undocumented or living in mixed immigration status households can face additional barriers to information and resources as well. And um, um, those facing occupational risk, especially for people working in industries with higher exposure to toxic substances, and finally, communities living with legacy pollution. So overall, we are encouraging a broader, more holistic view of risk when thinking about who to reach and serve. Next, please. We also want to highlight a few things we are really looking for in strong applicants. First, we want to see organizations that truly center community needs, strengths, and priorities in their work, not just in theory, but like really how decisions are made at that organization. Also, building relationships is key, the organization working in partnership with individuals and other organizations from communities being served. We are looking for programming that's intentionally designed to reflect the community, so it feels relevant and culturally grounded and responsive to the community they're serving. And finally, the organizations recognizing the broader context, how systemic racism and structural inequities have contributed to higher risks of toxic exposures and how they're actively working towards addressing those realities. Next, please. Yeah, so this is a quick overview of the scope of work. This is very high level. All the details are in the RFA. The funded applicants will not be working alone. They will be working in close partnership with us, Public Health Seattle King County, and also with communications consultants. And the plan is to first review existing research and what we have learned from past community projects, along with staff knowledge about traditional eyeliner. And from there, we will co-develop a communications and messaging guide, something that supports culturally responsive and effective conversations with community. We plan to co-create 1 to 2 outreach materials focused on lead and traditional eyeliner. And finally, in 2027, the organization will plan and implement community education activities and also an outreach campaign to bring this work directly into the community. Next, please. Thank you. Just a couple of definitions we wanted to highlight. So in the RFA, specifically in the scope of work, in the section where we talk about in-person community outreach, we mentioned the possibility of requesting product testing events. So these events are in partnership with Public Health Seattle King County, where the community members are invited to bring items from home to be tested for lead. We bring in the expertise and we ask you to provide logistical support for those events. And also, I just mentioned the messaging guide. And in the context of this RFA, a messaging guide is basically a written guide for organizations on how to share information with their community about lead in traditional eyeliner. And it can include examples of messages for social media posts, health information to highlight, culturally important considerations, etc. Next, please. Thank you. And in the RFA, there is also an optional scope of work. For this, we will select 1 to 2 organizations to receive additional funding to host in-person project meetings with up to 20 attendees per meeting. And the work for this scope of work could include things like providing staff to coordinate logistics with our team, renting, providing event space. This could also just be your own office if you're selected for this funding, managing event setup and takedown, purchasing food and refreshments, and also making sure that the space has adequate equipment to run those project meetings. Next, please.
And just to be clear, I was just thinking, the attendees for these meetings would be the folks who are funded. So it would be the folks that we're working with on this project. It wouldn't be open to the public. So it's really just an opportunity for all of us to work in person together.
Mm-hmm. Yeah, thank you for that. Yeah, so the project funding schedule, so this the funding has been structured in 2 phases across the 2 years. So in 2026, we'll start with $10,000 in funding, and the focus will be on co-developing communication and messaging strategies in collaboration with Public Health Seattle King County and also the communications consultant. And there's also an evaluation and reporting component to capture what is being learned along the way. And then in 2027, we'll have $45,000, and the focus really shifts into implementation this year in 2027. So we will work on co-creating outreach materials, running community outreach campaigns and workshops, and also continuing the evaluation and reporting. And when you develop your budget for your application, please remember that you're planning within the annual funding amounts for each year. So we are limited 10,000 in 2026 and $45,000 in 2027. Is there anything you want to add to that, Ashley? Was that clear?
I was just thinking, I was just going to add that for the outreach materials, your budget will just be the staff time to support what should be created, what the content should be, but the communications consultants will be the ones actually managing the creation of those shared materials. So making sure that's clear that you're not expected to do, creating handouts and things like that from this budget, but that will be something that will be co-created across all the funded partners with a consultant. And you all would just be supporting the messaging and what would be a good material to create, whether it's something like a comic strip or a handout or maybe a short form video, something that everyone agrees on together would be a strong tool for you all to take and use in workshops and campaigns and things.
Yeah, thank you. Next slide, please. Yeah, so for the optional scope of work, we have up to $4,500. And in 2026, we'll have $1,500 to host a September kickoff meeting. Like Ashley mentioned, it will just be staff, up to 20 people, staff from our organization, the consultant, and also the funded partners. So 10 to 20 people in September. Then again, we'll have $3,000 to host 2 in-person meetings in winter and spring quarter. Yeah, so that's again $1,500 per event or per meeting. Next, yeah, just a quick few notes on budgeting for your application. So please remember that the budget should cover the whole contract period, so which runs from September 2026 through December 2027. And we are also asking applicants to include a brief narrative explanation for any non-staff direct costs. You just need to provide enough explanation to help us understand what the expense is for and how it is estimated. For example, If you are budgeting for food, you might share how many events you are planning and, expected number of participants and estimated cost per person. And we also encourage applicants to include food and refreshments in their budget and to think about ways to make their events feel more welcoming and accessible to the community. Next, please. Just quickly, the RFA rating and review process. So as you're preparing your application, please carefully review the rating criteria in Section 8 of the RFA. And every proposal we receive will go through a formal review process using those criteria mentioned in the RFA. And Ashley mentioned this earlier as well. If the final ratings are very close, we may invite applicants to participate in an interview before final decisions are made. And we talked about this multiple times about the different funding streams. So we will use responses to question 1 and 4 to help determine the appropriate funding source for each award. So whether you receive BSK funding or HASWAYS funding. So we might use other criteria if it is. I think it will be possible to use just questions 1 and 4 for that purpose. But we might have to use other criteria as well to determine that. But again, it makes no difference to the funded partner on which funding source they are receiving. Did you want to add something? Yeah.
Yeah, I was just going to say it's stated in the questions as well. You'll see a little statement about that. So you don't have to memorize that it's questions 1 and 4. It's in there as well.
Yeah. And just the RFA evaluation criteria, this is mentioned in depth in the RFA itself, but here's a quick overview of how we will evaluate the proposals. So organization capacity is worth 15 points. We'll be looking at your mission, experience serving children and families, whether your staff reflect the communities you serve, and also your overall operational capacity. And then focus community is 10 points. This is about how clearly you define the community you serve, your understanding of their needs, your knowledge of traditional eyeliner use in those communities. And then community engagement and outreach is another 15 points. And this includes your approach to equity and anti-racism, how you build trust with communities, how you incorporate community input and demonstrate impact in your projects. And then project details, also 15 points. And here we are looking for a clear staffing plan and outreach strategies that are well-defined and culturally relevant. And finally, the budget itself, the budget itself is not scored, but it will be reviewed for completeness and also alignment with your proposed activities. So in total, this is 55 points for the written application. And I believe we set 20 additional points for the interview if we have to go into that phase of the evaluation process. And I think it's back to you, Ashley. Okay.
And please feel free to, if you have any questions, please feel free to put them in the chat. Okay, so I'm going to go into a little bit about how to apply and also talk about Agiloft. I will say it does take a little bit of time to get your Agiloft account set up, so I highly encourage that you set it up early if that is something you are interested. So there is a link both in the RFA and the BSK blog post, and then you'll see it in this slide deck of where to go to set up your account. The application is due by May 29th, and again, setting it up early will make sure that you don't run into any problems. And then here's just the link to the direct solicitation. You can also access it by just logging into your account, and I'll show you how to do that. This is just an overview of what applying looks like. So once you log into Agiloft, you'll go to what is called the Funding Opportunities and Solicitation page and view all of the available solicitation events. And there you will see the lead in traditional eyeliner solicitation in the list of open solicitations, and you can click on that to express interest in it and create a new response. The other steps is that you'll have to make sure that your provider profile is updated. So your organization information, your contact information, and things like that. And then you'll go into the actual application itself. And there are two pieces to the actual application. There's a summary question, which is the zip codes that you serve. So it's a simple summary question. And then you will upload two different documents. One is a checklist and narrative question document. So that'll have the questions that you fill out. And then the other is the budget template. And both of those will just be uploaded as separate documents within Agiloft. And then you will submit your response. And this process, as well as much more detailed instructions, are available online. I will share that link at the end. There is also a open office hours with the Agiloft team. So if you're running into problems and you're like me and it's hard to learn from just like a PDF, they can actually walk through with you and help you figure out what you're missing, what you need to do to get your application in. And what you'll be expected to turn in are those summary questions, which are completed directly in Agiloft, and that is just about the zip codes that your organization serves. And then you'll upload the checklist and narrative question document. And on that document are the 9 required questions that Hannah kind of spoke to in the rating criteria. So there are 9 questions about your organization, how you're proposing to do the project, the community you serve, and the way that you think about equity and anti-racism within the context of this work and community outreach in general. And we've got a word max in there because we don't want it to be too long. And then there are 2 optional questions, and that is if you want to apply to host the meetings. And those will not be rated and they will not impact if you are selected. So if you decide that that is not a good use of your organization's time or it's not something you're interested in, you do not have to answer those optional questions and it will not impact your score. And then the other piece is the program budget document, which is a Excel document that you will also upload separately to Agiloft. And here are the resources. We have these both in the BSK blog as well as on the Agiloft pages. There's some great resources. The PDF guide has step-by-step instructions on how to apply for funding. They also have a video that goes through the same things. And they have, this is just their general website where you go in to access it. And they have some more other information. For example, if you already have an Agiloft account, but you need to update it, they have guides on that as well. And then they have live drop-in support hours on Wednesdays from 11 a.m. till 12 p.m. via Teams. You can access that through that main website or through this Teams link. And if last minute you are still having issues and you need to get your application in, there is contact information for our contract specialist, Phil. Although we highly encourage, getting the Agiloft piece set up as early as you can so that ideally you do not have to just email in your application and attachments. And then we wanted to just share a little bit of information, what to expect if you're funded. For the contract, we're hoping that we will notify folks in mid-July of whether or not they've received funding and start the contracting discussions in late July and through August. With hopefully having the contract signed and active in September and getting that kickoff meeting going. This will be a deliverable-based contract, so we will have, when we are in our contracting discussions, we'll have you do a budget by deliverable and you'll invoice upon completion of deliverables, and we can talk about that more if you haven't had a deliverable-based contract before. Fiscal requirements and reporting, just some things to know, kind of the standards of what will be expected if you're funded. We have folks submit invoicing packages. So as you complete your deliverables, you'll submit an invoice and you'll also submit a project-specific general ledger, what we call a financial activity report, which is just taking that general ledger line items and putting them in to match your budget, so we can kind of see where we basically taking your real costs that we're seeing in your general ledger and comparing it to our projected budget and make sure that we're spending as we expected. And then of course, assigned invoice and any supporting documentation, which typically the main thing we would expect is if you're giving away cash value cards or any sort of giveaways as a part of your events, that you're maintaining distribution logs. That would be the main supporting documentation. Sometimes timesheets, but that'll just depend on our contracting conversations. And then another thing to note is that we do fiscal monitoring. This is just a short project, so it'll be probably just a one fiscal monitoring. And that process we can talk through as well, but typically we ask for sample financial documentation, and you will meet with our fiscal team once to go over those documentation. And then if there are any findings or recommendations on how to strengthen financial processes within the organization, you'll meet with them again to go over those recommendations. And then there'll be a request for you to respond with your plan for moving forward. And so that is pretty typical across any of our public health contracts. And from the evaluation side, we will, as a team, talk through what we want to collect to show how well we're doing for this project. But some of the things that we typically collect are things like the reach of our outreach materials, since this is an outreach focused project. So it could be something like the number of views or the number of folks that we provided handouts to, or we reached through WhatsApp or things like that. So depending on what work your organization proposes, looking at kind of the reach of outreach materials. And then as we're doing education within the community, we typically also collect participant demographic information. This would be at an aggregate level. So no names, no specific identifiable information, just how many folks living in X zip code did you reach? And also looking at age, gender, and race and ethnicity. And then we also try to figure out ways as a team that we can collect feedback directly from community members. So it could be surveys, it could be doing some sort of conversations. And we typically have like a brief narrative that we have your staff fill out at the end of the year as well. And for reporting requirements, what we'll expect to see is the more demographic and like reach information will be reported quarterly, and showing the work that happened over the last 3 months. And then biannually, we have folks submit that kind of narrative survey. So a little bit more of the qualitative data. So how are things going? What are you hearing from community members? What kind of successes are we having? Oh, and I see there is a question in the chat. Oh, and Henna, you answered. I can just, do you want to read it out, Henna, since you answered?
Sure. There was a question from Zainab about, do you want to answer it now or do you want to take it later after you're done?
Either way, I can
Okay.
keep going if that makes sense.
Okay. You want to just finish it? Yeah.
Okay.
Yeah.
No problem. Well, then let me pass it to Phil to speak to insurance requirements really quickly.
Hello, everyone. When you're turning in your application for this solicitation, you'll need to include your agency's or a copy of your agency's certificate of insurance. The standard insurance that you'll be required to have is commercial general liability, which is $1 million per occurrence and a $2 million aggregate. If you have paid employees, you'll also need a workers' compensation program. Excuse me. If anything in so those are the basics. If you have something in your proposal, for example, if you're going to offer transportation for members of the community to some event, you will need additional automobile insurance to cover that. If you are going to offer some sort of medical services that require a doctor or nurse, you will need professional liability insurance for that. Those items and the proof of insurance will need to be loaded with your original application. Next slide. This is a generic copy of a certificate of insurance, a COI. You'll see that at the top, that's where their general liability is, which is the one that we expect everybody to have. After that is the automobile, which You may already have automobile insurance. If you do, that's great. If you don't, that's also fine, as long as your proposal doesn't require you to provide any transportation. Underneath that, these folks did not have it, but that would be the umbrella insurance. That would be where if you were using a nurse and who was doing something that required having a medical license or medical coverage, that's where that would be indicated. On these, you can see that farther down they have professional liability, which is what they were using to cover their medical. They had cyber. If you are going to be collecting identifiable data from people, and you're going to collect more than 1,000 people's identifiable data, their names, address, social security numbers, then you will need cyber insurance. If you're going to be less than 1,000, we assume that there will be some collection of information. If it's less than 1,000 people, you do not need the cyber insurance. You also need to make sure that you have King County, or in this case, it's Public Health Seattle King County, listed as the certificate holder, which is showing in the bottom left corner of the certificate of insurance. I think that should cover our insurance. Yeah, additional insurance. You may be required to provide a certificate of additional insured, which is separate from your certificate of insurance. It's an endorsement. It's a separate item completely, or a separate document completely, that says, as is circled on there, that the King County and its officers and officials are additionally insured members of your certificate of insurance for this contract. That shouldn't increase your insurance rates, and you should be able to get a copy of that from your insurer. Any questions? Thank you, Saba.
Thanks, Ella. And again, this is just to kind of give you a sense of if you are funded, these are something, the initial kind of pieces to expect to hear from us for things that we'll need, and just kind of initial things to make sure you're prepped for things like invoicing. But anything else, Phil?
If you have not done business with King County before, you will need to complete a King County W-9, which is a tax form that gives us your tax ID number and your address so that we can set you up in the system for billing. If you've had a contract, whether that be with Public Health or DCHS, or the Parks and Recs Department, for all that matters, you will already be in the King County system, and so you won't need to do that. So only be if you've never done business as a consultant, contractor, vendor with the county that you will need a W-9 tax form.
Thanks, Phil. And I see there's a question in the chat. Will these slides be available for later reference? Yes. And this recording will also be available through the BSK blog. They put all of the information sessions up on the blog, so you can reference back to this recording and to the PowerPoint slides. And I see there is another question. Let's see. I think that was it for our intro. Oh, no. Did you want to speak to this as well, Phil? And then we can go to questions.
Oh, is this the debarment slide?
Yes.
Okay. If you are a debarred agency, you will not be selected, even if you do an application. If you are at any point unclear on whether or not you are a debarred agency, you are not. If you were debarred, you would know it. Debarment comes almost exclusively from being found guilty as an agency or an individual for defrauding the government. It usually means that at some point your organization did intentional false billings to Medicaid and Medicare. Uh, it means that you did intentional false billings to the county to get medical support money. Most of the time, we see that with small health clinics or pharmacies who have been intentionally overbilling for medication. It's would be very unusual if any of the agencies currently on this meeting would have been debarred. But again, if you had been, you would know, and we will, regardless, run your names through the database just to make sure that you're not on that list. So if you know that you are, you might as well not bother with the effort of filling out the application.
Okay, and I just saw that before we go to before I go to anything else, Phil?
No, we're good.
Okay, perfect. And that actually goes well to James's question in the chat. You wanted a little more information on the outreach events that funded organizations are holding. What kind of events are we envisioning? And can those be done in partnership with other organizations? Oops, I just lost it. Oh, there it is. Okay. If those community partner orgs were to physically host such events in their spaces, could funding be allowed to pass through to them to cover their costs? Yes, so I think there's a lot of flexibility in the events. That'll be part of the conversation as we start working together. We've talked about it could be integrated into existing programs. That's a lot of the work that we do is if, for example, you have family programming like a kaleidoscope play and learn, and you want to bring in some of these education pieces or an activity or just table at an event so we can talk to parents. That could be an example. You could partner with another organization. If you are going to fund sort of subcontract to another organization to support the work, part of that we would work together on making sure they're not debarred, which Phil just talked about, which is checking them in that database and making sure you have a contract in place that includes the language from King County. But yes, they would be, you could subcontract to help support another organization and partnering with you on an event. So the general idea is thinking about looking to you all as an organization of where we could best reach families and folks who are using traditional eyeliner and what would be the best way to make the event engaging and interesting, whether that's doing a standalone event or integrating it into something that you're already doing or partnering with another organization. So yes, definitely open to that. And then I saw there was kind of a back and forth about the history of lead in eyeliner. Did you want to speak to that really quickly, Hannah?
Yeah, sure. We had a question about lead eyeliner being regulated by the US, by the FDA in the US, and is a larger goal to collect enough data for potential legislation for eyeliner lead. Yeah, so yes, the FDA does regulate cosmetics, including eyeliners. But like I was mentioning earlier, that a lot of the traditional eyeliners are either like brought, directly by community members from their home countries, or they are sold informally or in a lot of ethnic stores. That are really hard to regulate. And also the goal of this work is not legislation, but not to say that the work could not inform legislation in the future. And we have influenced legislation. We passed legislation in Washington State that is the most stringent in the country. I will say it is still evolving. In 2025 we implemented a 1 ppm legal limit in Washington State, but there's been some back and forth because of industry pushback. But right now it is still 1 ppm. Yeah, so the goal is community outreach to reduce lead exposure. But again, not saying that this work cannot influence future legislation and policy work. We do have a policy team on the public health side and also on the hazardous waste side that we work very closely with. And if there are any emerging issues that we come across in the community that could influence policy, we work with them to make a project. So that is absolutely a possibility. And then Zainab also was curious about how these cases of how this lead in traditional eyeliner was discovered. And so, like I mentioned earlier, the health investigators, Rhoda and Aisha, are on this call, get cases referred through the DOH for any child that has elevated blood lead level. And through the home investigation, so Rhoda and Aisha will do a phone interview with those families and also do a home investigation where they literally test products that the child or the family is using or being exposed to. And that is where they came across lead as, traditional eyeliner as a significant source of lead exposure. And also through the product testing events we had done in various communities, it was discovered that a lot of the traditional eyeliners contained a lot of lead. Um, and yeah, and then the last question was about why these children were tested. So it is difficult to say for me. I'm not a health investigator, but in general, they could be tested for a lot of different reasons. They could be sick or it is part of a routine investigation. And the other thing is the refugee families go through a mandatory health screening in which they are tested for lead. And that is actually how a lot of the elevated blood level among refugee children is discovered. Um, so yeah, we work with one specific refugee community in phase one that I didn't mention, but we are expanding beyond that community to include all priority populations that are impacted by lead in traditional eyeliners. Yeah.
Thanks, Hannah.
Um,
And before we go, I do want to make a plug for the technical assistance team. I know there are a couple folks on the call from the BSK technical assistance consultants. I don't know if anyone wants to come off mute. I don't want to um, put you on the spot, but this is a wonderful resource. It is free. They are folks who are consultants who would work with you, and they can review your application, including providing edits and feedback. They can provide guidance and think through how you're responding to questions. And they can also help you decide if it's a good fit for your organization. So highly recommend reaching out to them. You can find the information on both the funding opportunity blog post, and there are PDF handouts on how to get a hold of the technical assistance team in Agiloft. So when you go in to apply, you'll see that there as well. And yeah, I see Rhoda from our lead investigation team also put a couple of different reasons that a family may be tested. So that is in the chat as well. But highly, highly recommend reaching out to the TAs. Any other questions or anything one of the TAs want to share?
Hi, this is Tasha Johnson with Crux Consulting. And while I'll come off mute, I will not come off camera right now. I'm a little bit under the weather, but I wanted to be sure to be here to let folks know that we are available. I am personally available as TA help. We have worked with a lot of different organizations in reviewing their grants at different processes, and a lot of times you might want just some final eyes, some more eyes on to make sure that they're hitting all of your cues and answering all of the questions. This is one of my first provider briefings, though, so I don't know if I'm giving too much info on that right now. But I think it's a great resource for organizations. And when I was working at one of our nonprofit BSK organizations, we definitely used it. for when we were applying for grants. So feel free to reach out. We have hours allotted for TA assistance, so please don't feel like you're bothering us with questions or anything like that. You know, some of those thoughts might go into not wanting to bother the TA providers, but we are here to help you. So please utilize the service.
Thank you, Tasha. All right. Well, thank you, everyone. I can stay on for a couple more minutes in case there are questions, but that is the end of our information session, and we really appreciate your time. If you have any questions, you can submit them via Agiloft, or there is, I believe, contact information for Phil, our contract specialist, in the blog. And again, the TA assistants can also help with a lot of these questions, so please reach out to them. And feel free to log off, but if you have questions, we are here.
Thank you.
Yeah, thank you, everyone.
Thank you.
I'll just leave it recording for another minute just in case any other questions come up.
Hi, I have very technical question if I may ask here. So
Yeah.
I created an account, but when I sign in now, it says that I cannot sign in. It just says, unable to sign in. So how can I reset my account, or is there a way that, the account can be enabled again?
Great question. Agiloft is very new for me. If you would like to put your email in the chat, I wonder maybe, Phil, I'm assuming you're the one who would have to do kind of the connection between a potential applicant. Would you be willing to connect him with the Agiloft support email?
Yeah, so actually I shared my email here in the chat.
Perfect.
All right.
And then I will also put in the chat, let me stop sharing, kind of the general page. And then there is that information, like that drop-in office hours on, I think it might be Wednesday. So it would be, you'd have to wait till next Wednesday, but there's a live Agiloft specialist on that office hours. So you could always go to that and they could help you figure out what's going on with your account as well.
Is that again with the same Zoom link, or how do
it is not? Let me get that for you.
Okay.
I'm going to drop that in the chat. You can get it here or on this. It's also just permanently listed on this web page. So it's a Teams link there. And then it's also on the right side of this web page, accessing Agiloft to apply for and manage contracts.
Okay, yeah, sounds good. Thank you.
Yeah, of course. Thank you. Any other questions?
Hi, I had a question about the outreach and scope and kind of the materials and everything. I wanted to get back to my team to discuss this further, but if we did have any questions, who would be the contact for that?
For like details just on kind of understanding expectations.
Exactly.
Yeah. So for any questions, because the RFA is open, they do need to go through Agiloft. So once you log into Agiloft, there is a tab for submitting questions, and then it'll be routed to Henna and I through Agiloft, and we will respond. It's just so that it's publicly available, so everyone who is interested has the access to the same information. So that would be the process. Or I believe you could email Phil, and he will let us know, but the preference is to go through Agiloft.
Oh, gotcha. Okay. Thank you.
Yeah. Anything else we can help with? All right. Well, thank you, everyone. I am going to stop recording, and this will be up on the BSK blog under the information session page, so you can come back to this at any time. And if you have any questions, please feel free to submit them to Agiloft and we'll respond as quickly as we can. But the TAs are also a great resource too, if you want to bounce ideas off of them. So thank you again for your time. We really appreciate it and we look forward to reading applications.
Thank you, everybody.